COVID-19 patients are being treated in hospitals across the country, but there is concern this may only be the beginning. As Mike Drolet explains, that's why some provinces are now considering allowing doctors and nurses trained abroad to join the frontline fight here in Canada.
COVID-19 has spurred a rush to build makeshift hospitals across the country. It's less for the thousands of cases overloading the system now as it is in anticipation of what is to come.
We are preparing ourselves in the next 2 to 3 weeks for a peak.
Like most physicians, Dr. Shabana Sikander sees a system in need to monitor COVID cases in isolation and support overworked hospital staff. It's why Ontario and BC are looking to create positions for foreign-trained healthcare workers.
I'm just thinking that why can't we work on prevention rather than waiting for the peak? Why can't we flatten the curve now?
In Ontario, 1 in 10 confirmed COVID-19 cases is someone who works in healthcare. And in Ontario alone, there are 13,000 doctors and 6,000 nurses who are educated elsewhere and are not doing what they were trained to do. But the province's program is strict. While few have applied because it hasn't been advertised, only 10 in 12 applications have been accepted, leading to the provincial opposition to call for requirements to be relaxed.
When you have between physicians and nurses close to 20,000 individuals, from what I understand, who've got credentials from other parts of the world, I just don't understand why we wouldn't collectively want to be able to get them onto the front lines to help.
But there's also this: how many will accept the risk of working in a COVID-19 positive setting? Even if BC creates an associate physician class, is there enough incentive to get people to apply?
A big problem is that it sounds like that it's temporary. We are thinking maybe some kind of pathway that leads to provisional licensure, conditional licensure, which ultimately leads to full licensure. Something like this.
That could take time to figure out, something the healthcare system has in short supply. Mike Drolet, Global News, Toronto.
COVID-19 has dramatically changed the way we live, work, and learn. By now, most Canadian students would have been back in the classroom now that spring break is over. But the pandemic has forced schools to remain closed. Instead, thousands of students are now getting their education online. After a downer of a spring break, Sienna Boxer was ready to get back to school, except it's still closed.
I was really excited and I really wanted to see my friends, my classmates, and some of my teachers.
The 12-year-old joins thousands of Canadian students now taking their classes online, but she's worried about being distracted at home.
I haven't really been able to focus a lot with a different environment. I think it's much easier because you don't get as distracted in a classroom. And as at home, I have all of my fun things.
All across the country, classrooms are empty, forcing teachers to rejig the curriculum with virtual classes.
Definitely different, but doable. But everything has to be done very small steps to not overwhelm the parents who are also now struggling and the children at home.
There will certainly be challenges. There may not be enough computers to go around the household now that parents are working from home. There isn't an exact system for grading either.
If online learning is the only way, it's problematic, and when it's attached to grading practices that are not going to allow all students to demonstrate their learning.
But experts say bringing down the walls of a classroom can benefit teachers by showing them new ways to teach.
I can use any object that I have next to me and I can give you a whole math lesson with it. So just randomly, absolutely randomly, I have this in my head. You can see it's the tissue box. And I can teach you a lot about the volume, about measurement, about density, about a lot of things, but you have to be creative.
Sienna is ready to get back to learning.
I think I will end up being prepared, but maybe not as prepared as if I was going to school regularly.
She has the maturity to understand this isn't a normal situation because all of her friends are in the same learning boat.